Good afternoon, everybody, and thanks for joining us. I'm Brooke Nolan, Client Solution Specialist from Employers Health. Before we get started, I have a few housekeeping items to cover. Currently, all attendees are in listen-only mode. Please use the Q&A function on the left-hand side of your console to submit any questions regarding the presentation, and we will address them at the end. A copy of the presentation is available for download and can be found by clicking the paperclip at the bottom of your screen. Watch for the recording to arrive via email tomorrow. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback as it helps us shape our future programs. And with that, let's get started and get ready to rock and open enroll. Joining me today as co-moderator is Ashley Snyder from CVS Caremark. As Strategic Account Executive, Ashley is the primary liaison between CVS Health and clients within the Employers Health Coalition. Today's panelists are Rachelle Firestone from the Kenan Advantage Group and Erin Penland from Designer Brands. Rachelle joined Kenan Advantage Group, North America's largest tank truck transporter and logistics provider, in June of 2012 as benefits manager and became the director of benefits in 2014. She brings a wealth of employee benefits knowledge to KAG. Rachelle is responsible for the design and ongoing development of benefit programs that meet the needs of KAG's employees. Rachelle has harmonized benefits for all 18 subsidiaries since coming to KAG. She has also centralized all benefit functions into the Canton Service Center and manages a team of 4. Her professional affiliations include the International Foundation of Employee Benefit Plans, Society for Human Resource Management, and she maintains her CEIVS designation through the International Society of Certified Employee Benefit Specialists. Erin Penland is responsible for the design and administration of Designer Brands' U.S. benefit plans. She has been employed with Designer Brands, one of North America's largest designers, producers, and retailers of footwear and accessories, for 12 years, 10 of which have been focused on the employee benefits experience. In addition to her role in benefits, Erin is co-chair of My Family Business Resource Group, focused on providing support and resources for working parents and families at Designer Brands. She currently maintains her CEIVS certification and is immediate past president of the Central Ohio IOCEBS board. Today we'll be discussing helpful tips for open enrollment, but first we will touch on some upcoming deadlines. So Ashley, I'll pass it on to you.
Thanks so much, Brooke. So we did want to take a few moments today to overview a few of the upcoming deadlines that we're going to have in the next couple of weeks as we prepare for open enrollment. So we did want to also note that you should have already received this information by your account team. So if you haven't, please reach out to them and ask for it. If you do look to have any plan changes that you might be making to your pharmacy benefit plan this year, please let your account teams know as early as possible. This really does help us to ensure that not only are they coded, tested, but they're ready for that January 1st go live date. So you will see a couple items on the screen here that the deadline is next week. So if you have any questions about if this would apply to your plan or not, please reach out to your account team to discuss. Most importantly, if you do have any changes that you're looking to make, we do require sign-off and returned signature back by December 30th to guarantee that those changes are effective for January 1st. So again, please reach out to your account teams if you have questions, and if you might be unsure if those deadlines apply to you, they'll help discuss anything that you may need to know. Now, we know that this time of year is a very busy time of year for everyone. Not only do you have year-end activity for your own companies, but open enrollment activity to get your employees enrolled in their benefits. We thought it could be helpful to have some of your peers online that have had successful open enrollments and benefit plan changes to have a conversation today around what they've done and what they feel has worked well for them. So without further ado, we'll have our conversation with Rachelle and Erin. So thank you ladies both so much for joining us today to go over some ways that hopefully will help the folks on the line today have a successful open enrollment and help prepare for that and any upcoming benefit changes. We do have several tips to outline for those on the call today, so we'll walk through each of these and have a conversation if that's all right with you. So now again, we know that a lot of these groups on the line today have a lot going on, but one thing that we've noticed is that groups that have been very proactive with their decisions in that timeline to implement have had more successful implementations and open enrollments. We advise that groups establish a timeline of what they're looking to accomplish for open enrollment and then backtrack on key dates to make it work for you. When you have this figured out, it's then time to communicate to your vendors. So, we'll turn to our panel now. And Rachelle, we know that you've been very proactive in the past, and you have such a vast and detailed history in the benefit world. So can you tell us a little bit more about how Kenan Advantage Group looks at your benefits and what changes how to make them? And how do you plan ahead for those decisions year over year?
So I think every year we are always looking at our medical trend. We keep a very close watch on what our medical claims are doing throughout the year, as well as our prescription claims, and determine, what services can we put in place that will prompt our employees to get engaged and help us cut down on our costs. So it's a constant. We watch all of our large claims, anything over 25,000. So we're constantly working on where do we need to focus? Diabetes, that's a given, but where else do we need to focus? So that's something that we do constantly throughout the year. And then watching your claims can kind of, are you within budget? Are you over budget? We like to use cash, which is also a little confusing at times, but we use that to see where we're going and what we need to do. So trying to look forward and do a 3-year plan, although it's very difficult in today's environment to try to do that because you never know what's going on with the medical out there.
Perfect. Thank you. And Erin, I know that you and I have partnered a lot together in the past with changes for designer brands. So is there, and you've always been very clear and concise in communicating those changes to us, which we always really appreciate. Are there any things that you do on the back end to ensure that your intent for any plan changes is very clear and timely to your vendors, not only us?
I mean, I consider clear communication and proactivity really to be key to success. At Designer Brands, we really do think of our vendor partners as an extension of our internal team, and we want to make sure that they're kept in the loop on changes that might impact them, both as we plan and as they're interacting with our associates. So while we start the process of open enrollment planning in the springtime, typically, we do try to keep our vendor partners abreast of any large changes we're discussing or thinking about throughout the year as we work on analyzing these changes, even if they don't come to fruition. I think good collaboration and discussion ensures that we're all on the same page with plan design and what we can and cannot accomplish together. Personally, I don't think there's a thing as over-communication when it comes to making sure that everyone is aligned on these type of decisions and who needs to own what role in them. We also, just from a communication standpoint, we do communicate throughout the year, but especially at open enrollment, we do put some materials into print internally. And so we make sure that our vendor partners are well involved in terms of creating those materials, making sure the numbers, the dates, the facts are correct, especially if there are changes, to make sure that we're all speaking the same language so that there aren't any miscommunications come open enrollment time.
Perfect. So I think the takeaway there is, you said as early as spring. So I think for the folks on the line, we start thinking about these very early on. So if there's ways that our teams can help you guide in the year-end activity or looking at those early on in the year, let us know. We're happy to help. Now, I know another thing that is hard to do sometimes with open enrollment is to be creative in how you market that to your employees. So I think if anything, the last couple of years has shown us is that it's very important to utilize your digital resources available to us. So this has really allowed a new avenue for our groups to how they engage their members that they may not have had accessibility to or engagement in the past. And we've seen that more groups have started to engage more digitally and also looking to add incentives to their plan for engagement or participation in open enrollment activities. So we're challenging groups today to get creative in how you approach open enrollment. I think those that have the most success have ways to get creative and ways to get those members engaged. So engage your resources, whether it be a consultant, a vendor on the line today, or your internal teams. So Erin, we know that digital apps and websites to promote open enrollment have become very popular through the pandemic especially, but are there ways that Designer Brands has potentially capped on those or utilized them to help with your open enrollment?
We use a lot of different, both digital and print options to support our associates. Since the pandemic, Microsoft Teams has really been a key tool for us in this new environment. In the past, we only did live presentations during open enrollment at our corporate office, but with Microsoft Teams being enabled for our entire company, it enabled us to actually reach a wider audience than we were pre-pandemic with live presentations. We know that with schedules, not everyone can attend a live presentation, so we also offer a series of short custom videos, along with a more detailed 30-minute long BrainShark recording. That's essentially kind of an on-demand version of our live presentations that we give each fall. Another thing we've been trying to do is incorporate QR codes into our materials to provide direct links. We know most of our associates were retail, so most of our associates are out in the field or in distribution centers. They aren't sitting at a computer all day. They don't have a company-provided laptop, but we know most of them have a smartphone and are using it. And so having those QR codes has been a big hit the last year or two. And we know if it can help them engage and access a site or resource, they're more likely to utilize it. Another thing we've seen a lot of success with is something called mobile wallet card. All of our information is there online. But then I think two things that are really interesting just to share that are more out of the box. I'm sure most people use email to communicate to your associates, but don't be afraid to make it engaging and eye-catching with gifts or fun things, messaging that catches their attention and makes sure they reads it. So we do monthly newsletters about open enrollment, for example. Themes have included rock and roll, camping, back to school. And we always get a lot of responses from associates and leadership telling me that the subject line or the gifts really hook them in and they learn something about their benefits. And then the last thing I recommend, we've actually been trying TikTok this past year. So we create our own TikTok videos internally about how to get signed into your benefits, utilize Teledoc, bookmark mobile wallet card, and more. They're just kind of a fun, quick way to engage associates in some way that they think is fun. And we've received great feedback on them and have seen a lot of engagement around the items that they've featured. So don't be afraid to, go out of the box with your, communication methods.
That's awesome. I love the idea of the QR codes. I think that's something that I personally haven't seen a lot of. So I think that could be a way to engage a lot of different demographics. Creativity sometimes isn't always easy because you have a large target audience to make sure that it's accessible and understandable for everyone. So Rachelle, can you tell me about anything that Kenan Advantage Group does that might be a way to creatively engage your employees during open enrollment?
Our population is made up mostly of drivers. So I would say 85 to 90% drivers who are not very receptive to creative ideas, we find. So we use a lot of different communication pieces, but creatively we do videos. Some of them can be a little silly. But we find that they're willing to watch a video. They're not necessarily willing to, scan a QR code. They will argue with you that they don't have a smartphone, but we know they do. So it's a little bit of a battle with that. I know that manufacturing sometimes also has that same. And our age bracket average age is 44. So we have a much older population that doesn't like to cooperate sometimes, but we do manage to get that information out to them. And for us, it's consistency. So we do every other year, we do a video that it's either our CHRO or myself to kind of introduce open enrollment and what's going on in the world of benefits.
Perfect. So I think the thing here to take away, at least what I've heard, is that know your employees, know what's going to work well. We had two different ways of engaging your employees, and it's because our benefit folks on the line today know their employees and what ways are going to hit home most for them. So keep that in mind for those on the line today, how we can further engage those folks. So we know that not only everyone on the line today, you and your employees have so much going on right now. So how do you help get them through open enrollment? So some of the things that we suggest trying to do is making your points as clear and concise as possible. We suggest also trying to provide important information that's going to be changing and then have that additional information accessible if you need it. Again, know your population, know what's going to be most important to them. And so, we know that each company has different ways of communicating those changes. We heard a little bit about it already. And with so many folks on the line today, we did want to get a viewpoint from each of our panelists on how they communicate effectively with their employees and what tools that they may use. So, Rachelle, I'll start with you first, and then if Erin, you could tell us a little bit about what Designer Brands does.
So when we have absolute changes that are going to affect people, like we'll remove a plan, we communicate personally to each employee that's enrolled in that plan with a letter explaining, why it's happening, what that means to them, what they need to do moving forward. We, throughout the year, the benefit team itself is constantly looking at our enrollment guide. They're listening to the employees during open enrollment. They're listening to the new hires. And we're making those constant adjustment updates like, oh, they didn't understand that piece. Let's switch it around a little bit. So by the end of the year, or by the end of August, usually, our enrollment guides from the previous year are pretty marked up because we try to constantly listen to what they're saying. And we do the Q&As with them, and that's what we do from the phone calls. We always make posters for the drivers, for the driver rooms, as they're coming in and getting in their truck. We also have what we call a Qualcomm system. So every time a driver logs into their truck, there is a message that comes across. It's time for open enrollment. We switched to a brand new system this last year, Paycom, and it does have some, with each medical, dental, vision, you can attach different documents to it, which we're finding last year we found that it was very helpful for our employees to be able to actually look at it while they were online enrolling. So those are just some of the ways, that we do it. We do pre-communication to all of our management team throughout the entire company, across the entire country. And it gives them the highlights of what might be changing. We haven't made any major plan design changes in several years. A lot had to do with the pandemic and, trying to keep things pretty even for everybody. But we still make sure that we get that management team the information they need because the employees, of course, initially come to them.
Awesome. And Erin, if you could tell us a little bit about what Designer Brands does.
So we actually utilize a lot of those same techniques. One of the main methods of communication, though, that we utilize with our associates, given that they are more of a younger kind of tech-savvy workforce, is truly email communications. We make sure they're targeted, though. So if you receive it, we want you to know that it's actionable and relevant to you in some manner. I don't want you to just think that we're mass blasting out information and then you start ignoring it because it hasn't been relevant. It does take some time to pare your list down only to those folks that it's relevant to, but it has resulted in some pretty sky-high open and click rates for our benefits communications because they know if they're receiving it, it's important and we want them to know. Even those monthly newsletters that we send out, they're customized to only show sections of the communications that are relevant to your situation. So, for example, if we're talking about how to file a claim for voluntary benefits, but you aren't enrolled in those, that section of the email is actually suppressed for you because it isn't relevant. So it's very, very personalized to your situation. If you don't have a dedicated company email, we do actually send all of our communications out to personal email. That's something we started trying probably about 6 to 7 years ago and been very successful. We do give associates the opportunity to opt out of these communications to their personal emails if they wish, but honestly, the vast majority do choose to stay subscribed so they can stay in the know. We also do short Q&A guides about things like maternity leave or how to file for your 401k, just so if you're looking for a little bit more targeted information, those are posted online. We started doing postcards. I know in the past we've tried to get away from mailings, but I think postcards have really become popular for us in the last year or two, and they've been helpful. We do 5 to 10 a year, highlighting different vendors, and it gives us an opportunity to reach sometimes those spouses who might be making all of the decisions regarding benefits. And, if they aren't getting the emails, that might be the only way they know that things are happening. So, And then the last thing that we have kind of put into place this year is it's a business card. So it's just a small business card-sized handout that is in all of our stores. It's double-sided. One side takes you to our careers site, and the other side takes you to My Mobile Wallet card, which is where all of our benefit information lives. It's meant to give information both to potential candidates to designer brands, but it's also great for internal associates who are just looking to learn more about their benefits. So it's an easy grab and go resource that's available at the front cash wrap for anyone to take and learn. We've seen a lot of success and a lot of engagement with those cards, just helping answer basic questions internally and externally.
That's wonderful. And I think this is going to tie in with my next question, Erin. Probably why we've seen so many successful changes within your population, because they always seem to be very aware of what's going on. So, for that, I think you talked about it a little bit already, but do you bring in other teams from your organization or other vendors that help push that message along to your employees?
We do. Our team definitely leads the push. So we do lean on our partners to provide collateral where possible, but we also are our own marketing department. And so we create most of our guides and handouts and emails. But just because we create them, we still rely on many, many partners to get that information out. The associate relations team is a key partner for us to help advocate with the front line to disseminate any updates that we might have. Leadership in our stores and fulfillment centers is key to helping reinforce messaging to those populations, provide reminders, and just high-level notes about resources or deadlines we're trying to share. And in the past, we've even used bathroom stalls. It's not really a team per se, but it has been helpful to us as well to communicate key points. It's a captive audience, and so it's been very, very successful to put a poster about an event or an upcoming benefit change in the back of a stall door. And we've even seen statistically, we've gotten hits on our websites. Things have spiked as we've put those in. We had to scale that back during COVID because unfortunately, most of our corporate associates now work from home. But we are still utilizing these in our DC locations, and they're still a very successful communication method for us. And then something new we are about to undertake is a partnership with our communications team. Starting this September, we're going to be pulsing out some of our benefits information on the DBI social media channels. So this is a new undertaking for us, but I think it's going to be an interesting way to start getting the word out about our benefits and changes that we're making, both, again, internally and externally. Our store associates are extremely active on LinkedIn. So this is a way that we're going to try to reach them to make sure they're getting some of the messages out about the benefits that we offer.
Those are all wonderful tools and ways to engage with your members. So love hearing all of that. And hopefully the folks on the line are taking some notes here too. I think some of the common themes here when we're talking this afternoon are just really keeping things clear and simple for your members, communicating what they'll need to know. I know sometimes we get stuck in our benefits bubble, and while we all on the line today may know what a PPO or a HGAP means, your employees may be a little bit less familiar with that. So, and especially if it's their first time through open enrollment. So try defining those important terms and using them in real world examples. I think also another thing that we've seen being a successful part of open enrollment are where benefit teams are handing out or distributing information or providing resources to your employees throughout the year, so that open enrollment isn't overwhelming as it may be. And it could also just be beneficial for those members to hear it throughout the year versus one time. So, Erin, your employees, again, kind of picked up on this before, that they always seem to really understand their benefits. What has your company done to really help educate them on it? And what resources folks are you pulling in to help there?
So our average full-time associate is under 40 years old. And there's a large portion of them that are much younger than that. And this is really the first time that they've been exposed to benefits. A lot of them are turning 26. They're having to make these decisions for the first time in their lives. And so we try to really support, especially that population, through a lot of the methods that I talked about earlier. Everyone learns and digests information differently. So all of the multiple mediums that we share hopefully can help meet them in a place that is good for them. We do focus a lot, though, on making sure that our leaders and managers know where to go to find information, because oftentimes that associate who is having trouble, the first person they might go to is that manager, is that leader. We don't want those leaders to be experts on our benefit offerings, but we do want to make sure that this population knows how to point to a few key resources, such as our team, Quantum Health, who is our care navigator, mobile wallet card, which I've talked about, to make sure that those associates know where to go to get that help that they need so they aren't frustrated. And then lastly, just being available and empathetic to the needs of our associates is also really important to helping them learn. Our team is heavily focused on customer service and providing that great experience. And we know benefits can be complicated. We've all learned this stuff. And if you think back to when you were just figuring out, it can be overwhelming. And so oftentimes, those who are needing to access this for the first time, there's a lot of stressors going on in their life. They may need a leave. They may be having a surgery. They may be trying to understand a plan change that we've put in. And so we work really hard to provide just that clear, concise information that Ashley was talking about. Try to anticipate that unasked questions because they don't know what to ask, and just make sure that they feel supported so that in the future, rather than just throw up their hands, they'll come to us to get those questions answered.
Mm-hmm.
Perfect. And we touched about this a couple times through the afternoon already, but it's helpful to engage early on. Rachelle, I know you'd mentioned before about starting in the spring that you're making those decisions. So your team's already aware of what's coming down the pipeline. And as you go to build out your open enrollment process, what does Kenan Advantage Group do to help educate your members through that process? Do you rely on open enrollment sessions or benefit fairs or anything in between?
Yeah, what Erin said is actually pretty accurate and spot on for us also. We've spent a lot of time developing our managers in the field so that they know those basic answers and where to direct the employees. We also do that. We spend a lot of time actually doing that. During open enrollment, so we will send out to every employee, it's coming. It's kind of a colorful little flyer. Open enrollment is coming. It will highlight the changes if there are any. And then we'll send that to their homes. We work with Lockton, our broker, who is helping us design our enrollment guide. And in that enrollment guide, it's like ABC 1, 2, 3 of high deductible healthcare plan. It's a lot of pictures, a lot of, arrows, follow this way, do that, as opposed to a lot of words, because I think it helps our employees quite a bit. And we also have quarterly for our 401k, we have sessions. We utilize Principal to have sessions all over the country. Most of them are virtual, but like Money 101, how to invest, what do I need to look, because we want to also address the financial health of our employees. So that's kind of how we work, but we do a lot of the same things that Erin mentioned too.
Perfect, thank you.
And so now time has been a keyword today that we've been talking a lot about, and it never seems like there's enough time in the day. Open enrollment involves a lot of planning. So along with that planning, we wanted to make sure there is enough time to communicate with employees so that they understand the timelines that are set. We also want to make sure that there are clear open and close dates for open enrollment with a silent period, so employees make informed choices with that allotted time. So Rachelle, I'll start with you. Something that you'll be asked often from your vendors is, when is your open enrollment? So everybody's aligned in that they know how to plan. So do you notice, or have you seen in the past that's worked well for your company to update or change your open enrollment dates year to year? And if so, why?
Yeah, no. When I first started here, they had 2 open enrollments, which was a little shocking. They did their voluntary enrollment at a different time than their regular enrollment. So we changed that, but we choose November. And what drove that a lot was when do our vendors need, when do the carriers need their files, their OE files, and consequently, that quarter for us is an extremely busy time of the year. The end of the summer, going into the fall, there's a holiday there. Considering what we do, it's highly, just busy. So we picked that 11/1 through 11/15 date. It gives us enough time. It gives us a soft close. We've got a hard close 3 days after that. And then we know that we can get everything in order and get those last files over to the carriers in time for those cards, because that's what everybody's looking for.
Awesome. Thanks. And just like Rachelle said, open enrollment is a busy time of the year. But Erin, what challenges have you seen with open enrollment dates, and how has your company overcome them?
We have made some tweaks to our open enrollment cadence over my time with Designer Brands, mainly based off of associate feedback and just our internal experiences. One of the biggest changes was actually making the decision to move our open enrollment up to actually the back half of October. Previously, I think we were probably aligned with you, Rachelle, with the mid to late November open enrollment. But we started getting a lot of questions from associates wanting the information in October, looking at spouses, but ours wasn't ready yet. And moving our dates up actually allowed us to share the information more timely with what our associates were asking for. We do also do that silent start and end date that you mentioned, Brooke. That has been a huge success, especially the end, because I can't tell you how many people wait till the last minute and then they email us that last day and say, oh gosh, I forgot. So they're able to get it in. But unfortunately, being in retail, we do still see a lot of people who forget, even with that silent day. This might be more unique to us, but we do a corrections period. And it typically takes place the first week of December. We would often spend hours in the past actually allowing associates who forgot to do open enrollment or needed to make changes because their spouse had an open enrollment by hand. And to combat this, we introduced this corrections period about 7 years ago. It's essentially just a mini open enrollment. We literally open the window up for a week, typically the first week of December. And if you missed or need to change something, you can go in and fix it. Now, we tell people cards are not going to be in hand. You may not have things updated with the vendors exactly on 1/1, but it does give you that opportunity to fix it. And we typically do see around 100 to 150 changes per year doing this. So it's a huge time saver for our teams and gives associate that peace, gives them that peace knowing that if something changes between open enrollment and closer to the end of the year, they can fix it.
Yeah, that's great, especially like you said, you have a younger population. So those kids who maybe they just turned 26, they're like, oh no, and they do need that corrections period. So that's awesome. So our next tip here, and this is something we hear in the workforce a lot, is keeping your door open. We want to make sure that employees and colleagues do feel comfortable to come and ask questions. And this is also true during that open enrollment period. Employees will have questions like we've been talking about today. So it's important to make them feel welcome so that they can come ask those questions when it comes time to make these important decisions. Like Ashley mentioned earlier, we may all know the basics of benefits, but not all employees do. You can also help reduce confusion by developing resources like virtual and in-person Q&A sessions or creating FAQ documents along with those open enrollment guides. And I think our listeners would like to hear how you both tackle open enrollment resources. So I'll ask you both, and Rachelle, I'll start with you, but what have you found to be successful providing to your employees in terms of those open enrollment resources?
So we actually have a benefit team of 5 right now, and during open enrollment, all 5, including myself, are all hands on deck. We work a pretty long schedule during that time frame, and we have an enormous amount of calls that we take, and we usually I think we've returned all calls on a daily basis. We usually stay here till that actually happens. So we utilize the team a lot. We utilize managers with, how to, they're all out there helping our employees anyway, try to, get into the system and enroll online. because it's still not something that most of our drivers are overly fond of. But we all are answering questions on a daily basis. Our Paycom system actually has a great Q&A area, and it also has a chat feature. So during open enrollment, especially, they use the chat feature, and even though you're on the phone, you can still respond to that chat. So usually that's how we kind of address that open door policy. It's everybody's on deck.
That's great. Yeah, a chat feature is always great to ask a quick question to get that answer right back at you.
Yep.
And Erin, I'll ask you the same question.
As I agree with everything Rachelle said. It's really an all hands on deck week for us, 2 weeks. We are a team of 3. So we do try to minimize the questions where we can, just through the providing those kind of overview documents and getting folks together in those live presentations. So at least if we're, all the questions can kind of be handled at once versus one at a time. We do rely on, our vendor partners. So we do rely a lot on our care navigator to help us navigate those phone calls so that we can really triage the live presentations and the emails that come in. And I think that's been a good dynamic that has allowed us to, it's a hard week or 2, but it doesn't feel overwhelming with that split. So leaning on your vendor partners where you can has been very helpful to keeping us successful, open enrollment for us.
Great. And Rachelle, one last question for you here. We know there are a lot of people behind the scenes to help create a successful open enrollment. So who from your team helps put this information together, and when in the year do you start putting that together?
It used to be my right-hand person, my benefits administrator, but she's actually left the company, so it's me. I work closely with our broker, of course, Lockton, and we kind of get that good jump on it because we really pay attention to what we put in our materials and how it affects employees. So every year we go through open enrollment and we hear people go, well, I didn't understand that. That's not what I thought that said. So we're constantly making those adjustments as we're going throughout the year. And then we really start to dive into it in the month of June. We have mostly all of our decisions from our C-suite by the end of August. And then, we're just rolling right into, the production and how we're going to address the communication piece, moving this year. Our CHRO does a personalized letter that goes in each enrollment packet. And it's interestingly enough, I think all 7,000 employees know who our CHRO is. So he's constantly out there and so he makes sure that is a personalized message from him. So it means something to the employees.
Yeah, that's great. The communication from all the way up in the C-suite, I know, really helps reach other employees as well.
Yep.
Our last tip today that we will share with you all is all around compliance. So compliance needs to be at the forefront of your open enrollment discussions to make sure that your company and employees are protected. We want to make sure that communications and strategies are legally sound. And luckily, your vendors, like we've been talking about today, are here to help and want to help. So use them as you have questions and rely on your consultants or any other partners you may have. Mm-hmm. So Rachelle, I'll start with you. There has been so much that has changed over the years in benefits. So how have you adapted to those changes and ensured your plan is compliant?
Yeah, that is the absolute truth. Trying to stay up with this is quite a feat. So I utilize every single resource that I have. I utilize Employers Health, their pharmacy benefit conference down in Columbus every year is a great way to hear what's going on legally. We use Lockton, our broker. They also have ERISA attorneys. We use the site Mineral. Usually we're using absolutely everything. Our internal legal counsel will provide those state laws that come out on sick pay, because that's all things that we have to keep track of, not only payroll, but benefits area usually. So it's definitely difficult to keep up with, but we probably set aside at least 2 days every month just devoted to trying to catch up on, what's happening, what else do we have to do? So, and there's quite a bit, but we use Anthem to utilize a lot of that information also.
Great. And Erin, like we've talked about a lot today, utilizing your vendors is a great way to fully understand the needs of the plan. But what other resources do you leverage to make sure that your plan is compliant?
So obviously, we lean heavily on our consultant partners, external ERISA and legal counsel, but I've also found it to be helpful to attend webinars like this one. Just reading the news, those have been very helpful to make sure that I don't miss key components of, the plan or items that might be changing. For example, the other day, I subscribed to the New York Times and I get the notifications on my phone and I got that pop-up about hearing aids are now going to be over the counter. And that's something we get asked about. So that was just kind of a key piece of information that it doesn't impact our plan per se, but it's just something helpful to know as I'm doing my job. So I think being open to utilizing some of those more free resources outside of your traditional vendors can really also help you stay on top of things from a compliance standpoint too.
Mm-hmm.
Yeah, that's great. Yeah, I've noticed that just signing up for those email subscriptions has been super helpful to get access to the news, since not all of us typically get the newspaper thrown on your driveway anymore.
Mm-hmm.
And that right there brings us to our questions section. So thank you both for sharing that insightful information. And we have had a few questions come in during our conversations, so we'll walk through those. But first, as a reminder to our listeners, you can submit your questions through the Q&A function on the left-hand side of your console. So first, I believe this first question is for you, Erin. Back when we were talking about open enrollment dates with yours being closer to October, this person would like to know, did you have an HSA or FSA option? If so, how did you do an October open enrollment if you're still waiting for your next year maximums?
This is one thing that does pain me every year, to go to print without the maximums. I've accepted that it's likely that one little number will be incorrect in our print materials all year. We do update it in our electronic materials once it's available. But in terms of the associate experience, it hasn't been a huge problem. What we typically do to get on top of it is, once our vendor updates the number to the new maximum, we reach out to anyone who actually maxed out their FSA for the current open enrollment and just ask them, would you like us to change it to the max? And most of them say yes, and they go in and change it during that corrections period. So it's just a little bit of an extra communication step, but it's a lot less time than what we were dealing with the November one.
Great, thank you.
Yeah. I think, and Erin, I'm going to add to that. Erin is we do the same thing that they do, but there's many a year, even a November open enrollment date, you still don't have what the new FSA amount is for the following year. So we do the exact same thing that they do. We reach out to our employees. Yep.
Mm-hmm. Yeah, that's great information. And I think this next question ties into both of you. And I know we've talked about it lightly today, but how has COVID and all the changes happening around that changed your perspective on open enrollment and your ultimate planning processes? So Rachelle, I'll start with you.
Well, that's interesting. COVID did not increase our utilization of teledoc or anything of that nature. We did have we suspended our wellness program in 2021 because of COVID, and then decided again in 2021 to suspend it in 2022. And all we require is an actual physical exam. So that has, fortunately for us, not kind of taken us backwards in claims experience. So we're putting it back in place, but I think COVID slowed that down for us, that progress of kind of making sure that our employees were healthier because they were establishing that relationship with the primary care.
Great, thank you. And then Erin, I'll go to you.
I think for us, with planning and our perspective on open enrollment and in general our benefits, COVID really allowed us to focus our efforts more globally. I I think in the past, we were probably a little more siloed than we should have been. And we focused a lot of our events and our communications on that corporate and the local home office population that we could see and talk to. And it was a lot more difficult to reach our stores folks because we didn't have the communication tools to get to them. But now we do. And instead of focusing on that one large population, we've really changed our structure and how we think about what benefits we're looking at to focus more on, those hundreds of smaller locations and work from home associates that we have. So I know like in the past, there was discussion around like, should we look at doing on-site childcare, for example? And maybe something like that might have been appropriate in the past. Now we would say, no, that only benefits a small portion of our population. We want to make sure that what we're putting in and doing benefits everybody equally. So I think it's less of a focus on that small corporate population, and it lets us look more holistically at everybody. The bulk of our folks are in the field. So that's an important group to make sure that, we're hearing their voice and they're a big part of what we're thinking about. So I think that was a positive change for us with COVID.
Yeah, that's great.
Yeah, I think too that it depends a little bit on, was your business an essential business, or did it get shut down during COVID? Those types of things, or did it have to get scaled back? We were considered an essential business, so it was pretty much business as usual for us.
We got shut down, obviously, being a retailer. I think shoes are pretty essential, but we were shut down.
Great. Well, thank you both for those answers. It looks like we have one more question that just came in. Have either of you offered incentives to get employees engaged to participate in open enrollment or different type of wellness fairs, such as raffles or anything like that in the past? And Erin, I'll start with you.
We have. We've done multiple incentives over the years. So in the past, pre-COVID, we used to do wellness fairs on site, and we would give you tickets for attending presentations, and you could enter them to win raffle prizes. And that got a lot of engagement from that corporate population. But even for open enrollment, we typically do a gift card raffle. So we offer off $10, $25 gift cards every year. And all you have to do is go through and finish your enrollment and push submit, and you're entered. And we've been doing that probably 5 or 6 years. And our average open enrollment percentage on a passive year is close to 70%, which I think is fantastic. So just giving them that little bit of incentive to go in and make sure their beneficiaries are right, their tobacco user status is right, and they have what they want for next year. It's been pretty successful for a very small dollar amount for us.
Great. And Rachelle, I'll turn to you.
Yeah, we've tried to do that before. We've used Anthem and the Live Health Online, and use the wellness dollars that we get from Anthem to kind of give gift cards out to employees. And we got a really good participation, but nobody actually used they downloaded the app. That's all they had to do, but nobody actually used it. So we haven't really done anything else as far as any incentives go. Although I love Erin's idea. That sounds like a great idea. Motivator.
Mm-hmm.
That's
they
awesome.
were DSW gift cards, if that helps too. We weren't using that's a good call out too. Like it wasn't an app or something to DSW. So I think that did help too, because it was easy for them to utilize.
There you go. Yeah.
Great. And that's awesome. Thank you both for sharing that. That's our whole goal for this webinar, is for other employers to learn from you guys. And so thank you so much for sharing your tips and tricks. And it looks like we don't have any more questions. So I wanted to thank everybody for joining us today. I hope you and your families are staying safe and healthy, and have a great rest of your day. And thanks for joining.